got that on camera.
So today, Monica, what are we gonna be doing for you today?
Everything, just do the eyes, do the nose, just do everything, okay? Just do everything.
Okay, so today we're gonna be doing a pearl laser for you.
Pearl, and I have a question, when we're ready to do everything else, can I have the pearl again, or do you wanna see the results?
Well,
Cause you know my
can-
skin is thick.
Yeah, you can do another pearl resurfacing treatment 6 months after the first one.
So when we're ready to do the major stuff, can we do it again, that way I'll have a great result? Because
You can
my
do it-
skin
you can-
is
but
probably worse.
It has to be a 6-month differential between the treatments, yeah. You can't do
Okay,
it, but it
all
can't be more abbreviated than 6
Then
months.
6 months,
Yeah.
alright, great.
So a pearl laser treatment, as you know already, is an ablative laser treatment.
Right.
So what's gonna happen is that this laser has a certain wavelength of light that's
Right.
gonna hit your skin, and what it's gonna do is it's gonna partially destroy the surface of the skin, which is gonna smooth it out. It's like polishing the skin
Right.
surface out.
I had the N-Light,
Yeah.
which with Le'Veon, because I break out,
Mhm.
so it was like the same thing and I peeled,
Yeah,
okay.
exactly. But this one, it's gonna take you about, on average, 5 to 7 days.
I
to
don't
heal from
mind,
it.
I don't mind, because when I had my surgery in '07, I went out with that babushka, I don't care what people,
You're not gonna be so babushka'd out today. But
okay.
your skin's gonna be very, very dry on the surface. It's gonna be flaky already, and then what's gonna happen is that layer of skin's gonna fall off over the next few days.
I don't care, even if it lasts a month like this, at least
It's
I'll
not-
have beautiful
You're
skin.
gonna have beautiful skin.
He's
But
the best.
But the pearl laser is a great new laser.
Great. I'll have Jackie D'Elia come here and she could have it.
Yeah. So this is the pearl laser.
And Dr. Jacono, I wanna ask you one question, and Joyce probably said no.
What's that?
Am I allowed to go in my pool or no before, till my water dump?
Not until I tell you it's okay.
Okay.
Okay. So this is the Kitera platform pearl laser.
Pearl.
And this is an ablative laser, which means that it's usually a one-time treatment laser, and it helps with acne scarring and resurfacing the skin, and also changes hyperpigmentation. So, Jackie's been sitting here now for about an hour with the cream on
And
her
you're gonna
face.
give me
It's
some
know-
kind of shot?
Yeah,
Now, Dr. Jacono, I probably won't be able to get rid of this. Remember when I was getting the,
sure.
right,
Yeah,
but
you're not
it's
gonna
a,
completely get rid of all scarring.
not a problem.
She has some scarring that she does. You can turn it off a second. You can hold the sweet
and also another question, when we do it in 6 months, can you pump up the volume? Because when I had the N-Light,
Yeah.
he went slow, and then the
We're not-
next time, he went a little bit higher.
Yeah, we're gonna give you a
Right.
full treatment today, so you
Right.
don't have to worry about pumping the volume. You're
Okay.
gonna get a full treatment
Because I
today.
know when the other doctor, he went,
Yeah.
okay,
Not with this particular treatment, I'm gonna give you a full treatment, so hopefully you won't need another treatment.
okay. But
Lots of times
but
you
if we
don't.
do, you'll let me know.
If we'll reevaluate your results after 6
Great.
months, and if you feel like you wanna do more, we can do more.
You're the best, I trust you.
Okay. So before we get started, how does your skin feel? Does it feel quite numb right now, or not really?
Yes, no, yeah.
Okay,
When
because I don't have to give you shots.
I would rather, because I get a little,
Jerry, okay, so I'm gonna give you a few shots
okay,
first, and that's gonna numb things up a little
Great.
bit more.
great.
And then
When
we'll
are you
start
gonna
the
have the
laser.
pearl?
I need to have my pearl done soon.
Dr. Kennedy can do it.
I know, what's this we're gonna do, we're one big happy family here,
Yeah,
we
yeah, yeah.
give each other Botox
Oh, God.
and laser treatments.
Now,
and
when
all
you're
that
ready
good
to do
stuff.
your face, but you have a long way to go, who does your face?
That's the
You
problem.
do
I
it
need to-
yourself, or?
No, you can't do it
You
yourself.
can't do that?
So I gotta have somebody do it.
Well, Joyce could do it.
Yeah, well, we'll see who does what.
Oh, God.
Turn you towards me, sweetie, okay? Nice needle this one, this one. Thank you. Turn you this way now. So you're gonna get about 4 shots here, okay? One's gonna go in your forehead first, a little pinch. This one. And then we're gonna give you a little pinch here, sorry. Is it okay?
Fine.
Okay. Dry sponge. Thanks. Take that. Shot each cheek. One here. Doing good. It's a nice little needle, so it doesn't hurt so much.
When you want something badly.
You'll do it.
Yep, you think positive.
Take this here, and I'll take a dry sponge back. So this start getting started. I have to put some goggles on.
Okay, any more shots?
That should be
Oh,
good.
that was fun.
Yeah, that's not bad, right?
No, that was a piece of cake. Are you still jogging?
Yeah,
Right.
I don't do it straight anymore because it affects my knees and my
That's
joints.
right, that's right.
So I go on the treadmill, pretty much 5 days days a week. But you know, the treadmill has a bounce to it, so it doesn't really
You know what I would
impact your
suggest
joints
to
the same
you?
way. What's that?
I have a pool in the backyard, 4 feet. I jog and box at the same time,
Uh-huh.
and it's great. It's the water resistance.
Uh-huh. Well,
So
well,
it's-
swimming is always the best.
Well, I don't swim. I just jog and box. So
Yeah, but I mean, being in water is
Oh,
the
definitely,
is
definitely.
the has the least impact on your joints. Okay. Alright. So, I'm gonna get started with your forehead, okay? And if you need a break, you just let me know. You might smell a little bit of smoke, hon. That's just the laser that's working on your skin.
I'm
Can I get a
fine.
little sponge? And we have a little, that's why we got the vacuum on so that it can evacuate the smoke. Doing okay?
I'm fine.
Hey Joyce, can you do me a favor? Can you make sure that the stays clear so it evacuates the smoke? Like you always do. You know, so over here, everybody gets. Just unplug it. Can you turn it this way more? Stay right there, Susan. You doing okay?
Fine. Good. How are you?
I'm doing great today.
Great.
Today I got to see one of my favorite patients.
Me, right?
That's right. We always have a good time together.
You're great.
So we're going to do another pass now. Second time around in the same areas. Doing a second pass makes the resurfacing more complete. It smooths things out even more. Okay, hon?
Mm-hmm.
Just gonna move this little thing up a little bit on the side here.
You okay, Doctor?